I would say that because we go over, you have to commit if this is what you want to try because it's the least invasive, it's the most time consuming, but it's the least invasive. Those patients come back. I will say my majority of the people that do it are retirement age. I do have some young people who do it though. And it's 85% success rate if you look at it across the board.
So we've done first line medication, second line hands-on physical therapy training. Now we go third line.
So third line, there's 3 options that really are helpful. And they're in no particular order. So it's not like you have to start at one and go to the next one. You choose what fits into your lifestyle, what you're most comfortable with, and what you can commit to. So I'm just going to start with the one that's sitting here the closest to me. And it's called urgent PC or tibial nerve stimulation. The company is Urgent PC that we use. There's another one out of there that Medtronic has a device also. One's not better than the other. It's just 2 different companies. And this is the one that we currently have in our practice. Ours is controlled by the hospital, so we just do what we're told. So with this one right here, there's a stimulator, and we use your foot, and we put a grounding plate on the arch of your foot, and we put a small needle into your between your Achilles and your ankle bone. So that soft, squishy tissue that's on the inner aspect of either foot, we measure and we tap in a little acupuncture needle, just a tiny little thin needle, and it should not hurt. And then we connect it to our stimulator, and we turn our stimulator on, and you're going to feel a tingling sensation either going down towards your foot or up your leg. That's how we know we're closest to the tibial nerve. So the tibial nerve sends a message, the stimulation sends a message up the tibial nerve to the sacral nerves that are surrounding and feed the bladder and the pelvic floor area. And so it gets a bladder that's overacting, it gets it to relax and calm down. And it is a procedure that you come in, we put in a little acupuncture needle, you either sit in the chair or you lay on the table or whatever. We used to have a recliner, but we ran out of space, so we don't have a recliner anymore. And you just sit there for 30 minutes. And if it ever hurts, we can turn it down. It shouldn't hurt, but you should always feel either like a vibration, like a or a pulsating kind of sensation, and it kind of feels like your foot's falling asleep for a little bit. And it is a 30-minute procedure. It's weekly for 12 weeks. And then you have to come back every month to 6 weeks for a maintenance, just one therapy then. It's covered under Medicare, which is what all the insurances go by for this, for 3 years. After that, we either have to switch to a different therapy. In some cases, after that, their bladder has been retrained and they've worked on all the other things, like their behavioral things, their fluid intake, all those kind of things. And some people say, I'm good. And, they do well because they've changed a lot of things all at once. Some people it doesn't work for. We give you at least 6 good weeks. If we're not making any improvement, we're going to probably recommend it's not going to work for you. The only people who can't have it are somebody who's pregnant because it's not been tested in pregnancy. You're not supposed to have any kind of pacemaker or heart thing in your body because they just don't have the studies that they want to try that on somebody. And you have to have your leg. We can't do it if you're an amputee, both legs. If you have one leg, that's fine. We can use the same leg each time, or we can switch back and forth from one leg to the other. If you have peripheral neuropathy from diabetes, you can still have it because we look for a reflex of either your toes curling, and that's how we know we're in the right spot, or they'll spread apart. And so we know we're in the same area there. But typically, most people aren't bothered by it. When I was at my other practice and I had my own actual center, I did about 3,000 of these a year.
Wow. How's compliance with something like this?
So I would say that people because we go over, you have to commit if this is what you want to try because it's the least invasive, it's the most time consuming, but it's the least invasive. Those patients come back. I will say my majority of the people that do it are retirement age. I do have some young people who do it though. It's 85% success rate if you look at it across the board. Sometimes patients have to do a layered therapy, meaning they still have to stay on their medication, and this is just tweaking it a little bit more. Now, during COVID, we had this time where we couldn't bring people in. So there were a lot of studies in Europe that said that they were using just a TENS unit, the TENS unit that people use for pain, that they were using a TENS unit, which is not a needle inside, of course. You would just put the patch on the arch of your foot and then in that area where I told you between your bones. So you don't need all 4 patches. If your TENS unit has 4 patches, you only need 2. And you do it every night for 30 minutes at least for the first 6 to 12 weeks. And then you can kind of cut back to weekly after that. And patients do that. And some people want to choose to try that. And I get probably 25% that say that just that alone works for them. So there's that piece, and that's the tibial nerve itself. It's least invasive, still has a good chance of working, but most time commitment.